Indeed, it's a very beautiful and a blessed morning, and I'm delighted and honored to be amidst your presence here this morning at this very auspicious occasion that marks the opening of the much-awaited state-of-art facility here at the new at Makoi, the new Makoi Maternity Unit. Ladies and gentlemen, before I begin, I'd like to echo the sentiments of Dr. Fong, who has acknowledged all the partners and stakeholders who have actually worked hard to see us today and to see us here at the opening of this state-of-art facility. And I'd also like to thank the former minister and his vision for having a facility such as this here in Makoi for the better of the community. I'm pleased to say that the new Makoi Maternity Unit will radically improve the quality of service and infrastructure for our patients and staff, both in the immediate future and in the years to come. Ladies and gentlemen, this new development is indeed a reflection of the Fijian government's unprecedented commitment to enhance the accessibility of basic services like healthcare to all our Fijians. Having this new Makoi Maternity Unit closer to your homes will mean that our expectant mothers will no longer have to travel all the way to CWM to access the basic medical services. Today indeed is a new day, and today indeed is a very proud day for the people of Makoi and the greater Nasino and Suva areas, and of course for the Fijian people at large. As mentioned, the new health facility has been equipped with an enhanced equipment and resources to take our services to a much higher level. It is here that our expectant mothers will get the much needed medical care and advice to give birth to healthy babies. Here, our children will be vaccinated against diseases that once preyed on their health. It is also here that our women, our children and families will be educated about maintaining proper diets and healthy lifestyles that will help prevent NCDs. I need not talk further about NCDs. I'm sure you're all aware that NCDs is one of the major social evils that is plaguing our society. And as such, our government, the Fijian government, continues to focus on improving services to mothers and children, and the Ministry of Health and Medical Services' concerted effort with the World Health Organization and our other partners has seen significant reduction in maternal adverse outcome rates for the 3-year period of 2011 to 2013 period compared to 2013 and 2015 period. Maternal death ratio, MMR data, has fallen from 39.2 per 100,000 live births in 2011 to 2013 period to 30.9 per 100,000 live births in the 2013 and 2015 period. Ladies and gentlemen, the idea of having such a facility here in Makoi emanated, as you've heard, through the ministry's focus to best accommodate the health needs of the increasing population within the Suva-Nosori corridor, and it very much complements the new maternity unit expansion at CWM Hospital later on. This expansion is currently in the final design stages, and I have been informed that construction should begin around the middle of the year at CWM. Ladies and gentlemen, the Makoi Maternity Unit has been built with an investment of 6.83 million Fijian dollars by the Fijian government. Further to it, more than 300,000 Fijian dollars of latest medical equipment has been purchased for the new unit to ensure that we provide a higher standard of maternal health care services to the population of Makoi and the neighboring communities. Indeed, this facility is not only unique in its design, but also with the new concept, we are providing the specialist care services that is normally provided at major divisional facility together with the primary care service, all in the same facility under one roof. This development indeed is a milestone achievement for Fiji and has, like I said, been made possible through the ongoing commitment of the government and other stakeholders to see that everyone has efficient access to healthcare service that they truly deserve. We are calling it as the Makoi model, ladies and gentlemen, and it is an attempt to increase further the access to specialized medical services for our communities, while blending the two levels of healthcare so the transition of care for mothers and babies between the levels is smooth and hassle-free. As the maternity services at CWM will extend to this new maternity ward here in Makoi, this will definitely ease the pressure and demand at CWM. Besides this, the new unit will also broaden the healthcare services for children, childcare, and also primary care services all under one roof, and we hope to replicate this model in other centers around the country in the coming years. This facility, for information, has been operating from 27th November last year. due to the demand from the community for services. In a short trial phase, we were able to make necessary adjustments about the scope of services and map the way forward to deliver this model of service. We anticipate that as we go along, we will continue to adapt further to ensure that we are providing the best in accordance with the needs of your community. This facility will be manned by doctors, midwives, and nurses who have been trained in maternal health and child health care drawn from CWM and the Central Health Division. The services at this unit have commenced with ambulatory services, that is antenatal clinic, booking clinics, and maternal child health clinic. Birthing services will follow in 4 to 5 months as the utilization of services increases and our coordination of services between CWM Maternity and Makoi Maternity strengthens. More staff will of course join the facility to boost the current staff that we have. At this juncture, ladies and gentlemen, I'd like to thank the community here at Makoi for the support in undertaking this significant development. I'd also like to thank our contractors and consultants. I'd also like to thank the Minister of Infrastructure and Transport and Minister of Economy for their support. I'd also like to acknowledge the work done by my team at the Ministry of Health and Medical Services, the Asset Management Unit, the Deputy Secretary Hospital Services, MS, CWM, including your staff, doctors and nurses, who have been deployed at this unit and are encouraged to take care of this new facility to look after it well. And as the government tries to uplift the health infrastructure, I urge you all to cultivate the values of care and compassion in your daily service to the general public. Please work diligently and always be responsive to the needs of your patients as they trust and depend on us for the best care. And to achieve efficiency within your health facility, especially this one, you need to nurture the principles of unity and teamwork, as I'm sure we all believe that no man is an island as such, and we all need to work together as one team to carry our roles to the best of our abilities. I'd also like to put on record my appreciation to all the retired midwives who have shown their interest to continue with the services again with the ministry. Thank you very much. I'm sure we will learn a lot from your experience over the past years of your service. I'd also like to encourage more young people to pursue their tertiary education into medical field, as we are all aware that the country is indeed in need of more medical professionals and we are facing shortages in this area. Similarly, ladies and gentlemen, my plea to the community around, please continue to render the same support to my staff here, as they are here to help and take care of you and your families. I would also like to urge mothers and expected mothers to make the most of these facilities. Please book for clinics early, attend your antenatal clinic regularly, and feel free to come and ask questions and clear your doubts about your pregnancy. Bring your child to maternal and child health clinic regularly, and please follow the advice of the medical health staff here. Ladies and gentlemen, having said that, the healthcare system is very important, and the services that the government provides are equally important. But building new health facilities are not the only ways to improve the health of our Fijians. The choices we make, the way we determine to live our lives and raise our children are equally important. Good health goes much, much deeper than treatments and immunizations. Really, good health is determined by how we choose to live. It's the choices we make on a daily basis for ourselves and our families. We must, all of us must step up our efforts to emphasize that prevention rather than cure is the best way to relieve the huge burden that NCDs are having on our health budgets and the system as a whole. The burden on our hospitals and health clinics caused by diseases can be prevented, and it is the responsibility of every Fijian to play their part in its effort. So together we can continue to build a Fiji that is healthier, stronger and happier. The ministry is capitalizing on a multi-sectorial approach to achieving the national goal of a healthy population. We continue to broaden our partnerships by joining hands with our UN partners, UN agencies, corporate sectors, community groups, faith-based organizations, charitable organizations, and of course with our international development partners to build and sustain the healthcare services that every Fijian truly deserves. Ladies and gentlemen, lastly, as I have reiterated, we are here to serve. We are here to serve, and we will not be deterred by cheap political tactics or critics that continue to level against us. We will continue to head on with all the challenges. We will continue to modify our processes. We will continue to address the gaps that exist. We will continue to build on our resources and strengthen our health workforce to uplift Fiji's health services and intensify our reach to every Fijian. With these words, ladies and gentlemen, I'd like to thank you all for being here this morning. Thank you very much for partnering with us. Thank you very much for having the health of our citizens at heart. And again, once again, a very, very special thank you to all the medical staff. You continue to work, and I'm sure you will continue to provide the services to the best of your abilities to every Fijian that enters, not only this facility, but all our facilities across Fiji. So God bless, and thank you very much for being here.